Ever had a weird symptom that just wouldn't go away, but every doctor you saw looked at you like you were making it up? You try to explain it. My joints feel like they're made of rubber, or I'm exhausted all the time, no matter how much I sleep, and all you get is a shrug. Or worse, it's probably just stress. For 1 in 10 people, this isn't just frustrating, it's life with a rare disease. There are over 7,000 rare diseases, but most doctors will never see many of them in their entire career. So patients end up waiting years for a diagnosis, getting misdiagnosed over and over, and often left wondering if they're just imagining it all. Today, we're talking about why rare diseases are way more common than you think, the frustrating diagnosis journey and why it takes so long, the science that's finally helping people get answers. If you've ever felt dismissed by a doctor, stick around, this episode is for you. All right, pop quiz. What do these conditions have in common? A disease that makes kids age at lightning speed, a disorder that makes your skin stretch like elastic, a condition where your body just forgets how to use copper. Answer? They're all real. Progeria. Kids with this condition age rapidly, developing wrinkles and joint problems in childhood. Ehlers-Danlos syndrome causes hyperflexible joints, fragile skin, and chronic pain. Wilson's disease. The body can't process copper, leading to liver and brain damage. And those are just a few. Here are some more you might not have heard of. Stiff person syndrome. Your muscles seize up, making movement painful and unpredictable. Fibrodysplasia ossificans progressiva, FOP. Over time, soft tissues turn into bone, essentially locking a person's body in place. Alkaptonuria, black urine disease. Your urine turns black when exposed to air, and your joints break down over time. Paraneoplastic pemphigus, a blistering skin disorder that can be a sign of an undiagnosed cancer. The list goes on and on and on. But here's the thing, because each individual disease is so rare, they don't get much research or funding. That means most doctors aren't trained to recognize them, and patients get stuck in a cycle of confusion and misdiagnosis. So, here's a frustrating fact. If you have a rare disease, it'll take an average of 5 to 10 years to get diagnosed. Why? Most doctors have never seen your condition before. Symptoms look like more common illnesses, so you get misdiagnosed over and over. Some diseases don't even have a test. Imagine going to the doctor, feeling awful, and they say, "It's just anxiety. Maybe you need more sleep. Try exercising more." Meanwhile, your body is literally fighting itself, and no one can tell you why. For many patients, this cycle repeats for years. And in some cases, by the time they get a correct diagnosis, their condition has already done permanent damage. But the good news? Science is finally catching up. Not long ago, if doctors didn't recognize your symptoms, you were out of luck. Now we've got some game changers. Genetic testing. Instead of just guessing, doctors can now check your entire DNA for mutations linked to rare diseases. Whole genome sequencing. This takes genetic testing to the next level, screening for thousands of conditions at once. CRISPR and gene therapy. We're not just treating symptoms anymore. Scientists are working on actually fixing faulty genes. Online patient communities. When doctors don't have answers, patients are finding each other on Reddit, Facebook, and even TikTok to compare symptoms, share research, and push for medical progress. If you or someone you love is dealing with unexplained symptoms, here's the takeaway. Don't stop pushing for answers. Keep track of your symptoms. Get second or third or fourth opinions. Ask about genetic testing if no one can explain what's going on. Join online patient groups. Sometimes, other patients know more than doctors. The more we talk about rare diseases, the more research, funding, and awareness we get. That's it for today's episode of MedHeads podcast, brought to you by meducate.com.au, your go-to source for health education. Stay informed, stay persistent, and we'll catch you next time.